Golden hour is the first 1 hour of life and of infant. So it's really very important, especially when we talk about preterm babies. As we know, preterm babies are the medically most fragile patients whom you ever see in the hospital. So we offer a lot of life-saving extensive therapies during first 1 hour of life.
The biggest advancement that we've had over the last 2 years is the development of our high care area, which is both an intensive care unit bed as well as 2 step-down beds or intensive monitoring beds where moms can stay when they have complications which either may be obstetric related or may be due to underlying medical conditions, but they're pregnant.
The infant stabilization room has been a long-awaited dream come true for 2 divisions who work very closely together, the obstetric services and the neonatal services, in trying to create the optimal environment for vulnerable babies to be cared for.
I would say the advantage to the process of having the infant stabilization room is just that critical aspect of developmental care and clustering our care together instead of doing a little bit and then leaving them alone and then going back and bugging them again. It's just too much for them. It's so much more of thinking about the baby and what's better for the baby and what things need to be done to provide the optimal care for the infant.
The whole unit has been designed with patient safety and patient care being a priority. It is located adjacent to our operating rooms, which makes it geographically close for those patients who have complex surgeries related to their pregnancies, and is also geographically close to our new infant stabilization room, where if their babies require complex intensive care, they usually go as a transitioning time prior to going and being admitted to the NICU.
I thought the care was phenomenal. The doctors, the anesthesiologists, and they were all very comforting, and they were very accommodating and making sure that everything was going smoothly for her. That she was gonna at every point if the baby came, that she was gonna be able to see them right away.
So by having an infant stabilization room, we would give a focused, uninterrupted care by a single team, and all the things will be done effectively and efficiently within 1 hour of life.
In the past, a newborn who was going to require neonatal intensive care would have been transported to the neonatal unit in a transport incubator, which would have resulted in the baby being handled on at least 3 separate occasions during the transit. What we have designed minimizes any handling and actually completely removes the need for handling for the baby within the first few days of life. And we know from evidence that minimal handling and optimizing respiratory support offers significant benefits to newborn babies in terms of allowing them to stabilize effectively and in some cases significantly reducing the risk of them requiring escalated levels of therapy.
So now the babies are delivered in the operating room and they are placed into a bassinet by the obstetrician. If they're really little, we have a special warming pad in the bassinet so that they maintain their warmth. And then they get brought into a room called the infant stabilization room, and the entire team is sitting ready in that room to accept the baby. We go ahead and we start IVs there, we do umbilical lines, any x-rays that need to be done, any blood work, we try to get it all done there. The initial medications are done, and then the babies are placed in a nice prone position, so on their tummies, with the head of the bed elevated, and the lid comes down. Then we attach the ventilator to the incubator, and it takes about 4 people, but we move the entire device with the baby, nice and cozy and contained in a warm, humidified incubator, providing all the ventilation that she needs. And there's no interruptions then. She just gets placed right into her spot in the NICU, and the goal is then to not touch her for the first 6 hours of life, let her stabilize.
Yeah, so then, I don't know, yeah, you're on a high, like, just in cloud nine, right? And seeing the doctors take care of them and the Neo team and everything, and once you see all the monitors and how they're stable, it's even like your high gets bigger, because now you know that you have 4 healthy kids, right? And
there's been a few advancements in an ICU in the 12 years that I've worked specifically at McMaster, and you know, this is one of the more exciting ones, to really see such a difference in the way we're doing our stabilization and the resuscitation of the babies.
I think the close geography to the labour and delivery area is super for moms. I think it's super for their care, because it certainly resulted in the obstetricians being more intimately involved in this care at this time, so that they're still seeing doctors who've been involved in their care throughout the pregnancy.
Just before we are leaving the infant stabilization room, it gives us an opportunity to give the feedback to the obstetricians and the obstetric team members. And also, if mother's say delivery is done earlier, before she goes into the postnatal ward, she has an opportunity to come and have a look at the baby, say bye-bye, and then go back to her. So in a way, I personally feel it would keep the neonatal team members very satisfied, obstetric team members very satisfied, and the parents would be very happy too.